I'm going, and I have. I'm just going to get somebody else read it and find something that I didn't.
Rachel doesn't make it instead.
Okay, Rachel will be back any moment to officially begin recording our minutes. So I will go ahead and read the electronic meeting notice. We'll get that out of the way.
Last one.
Yes, this is the last one. This meeting of the Health and Education Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus.
Madam Chairman, I so move.
Commissioner Gurley. Commissioner Blair, very good.
Commissioner Cook, Commissioner Blair, Commissioner Key,
Here.
Commissioner Gammon,
Yes.
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Chairman Allen.
Yes, very good, thank you. Our first order of business is to approve the minutes from the previous meeting.
Madam Chairman, I've read the minutes of the last meeting, find them to be in order, and without objection, I move for their approval.
Good, thank you. We need a second.
Second.
Commissioner Gammon? You'll call the roll.
Commissioner Key,
Yes.
Commissioner Gammon,
Yes.
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Blair,
Yes.
Chairman Allen.
Yes, thank you. All right, next up is our Health Department report. For our esteemed Health Department, welcome.
Thank you, Madam Chairman, and Mayor Katrin, Madam Chairman, and Commissioners of the committee, good evening. I am excited to share with you all our COVID-19 updates, and I will be presenting the Health Department report of Community Health Outreach and providing COVID-19 updates alongside with Dr. Lori McDonald. So if you will, please take a look at the March 2021 report of Community Health Outreach. So once again, as I've done the past couple of meetings, our 3 columns labeled Promote, Protect, and Improve have not changed much as our staff continues to work hard to ensure that we test, vaccinate, and provide education and guidance to help mitigate the spread of COVID-19 here in our county. However, we will start to see a couple of changes as we are starting to see a little bit of a light at the end of the tunnel, and it will start opening back up slowly but surely here at our health departments in Murfreesboro and in Smyrna. So now getting to our COVID-19 updates, as we have had a lot of updates over the past 24 hours, and we're going to share some of those updates with you, as well as continue to spread information through our public information officer, Ashley McDonald, who has been a tremendous asset to us here at the health department in getting information out to the general public. So testing, we continue to offer testing Mondays from 11 a.m. to 1 p.m. and Tuesday through Friday from 8:30 to 10:30 at our State Farm site located at 2500 Memorial Boulevard here in Murfreesboro, Tennessee. Of course, one important update, as we mentioned last time on our call, is March the 15th, we did move to appointment only for our nasal swab PCR testing on Tuesdays and Thursdays. So if you or someone you know would like to schedule an appointment for the PCR test that we will complete, you can call the Rutherford County Health Department at 615-898-7880. Again, our phone number is 615-898-7880. As a reminder, both our oropharyngeal swab PCR and COVID-19 self-tests are free. However, the self-test kits are not approved for children under the ages of 18. And children and adults who are unable to register online can also, once again, receive the standard drive-through nasal COVID-19 test on Tuesdays and Thursdays by calling to schedule an appointment. Along with testing, we do continue to work all public health investigation that goes along with all positive cases and their contacts 7 days a week. So over the last 7 days, the average of positive percentage was about 7%, which has declined with a case count of about 340 over the last 7 days. Once again, I want to thank our amazing staff here at the health department. Chris Clark, law enforcement, and EMS for their continued support of our testing and vaccination. So moving forward with vaccinations, so on April the 19th, we started our late evening hours on Mondays until 6:30 to help expand access across our counties for individuals who may need to have later hours. And then on Fridays, we start our early morning appointment. Additionally, today we did announce that we are offering walk-in options for individuals to receive the COVID-19 vaccine. While appointments are still highly encouraged, they are not required during this time frame that we're going to be doing the walk-in appointments, which will be Monday through Friday, 11 a.m. to 2 p.m. at State Farm Operations off of Memorial Boulevard in Murfreesboro, Tennessee. So once again, we'll have that drive-through testing that will be completed during those times. They do not have to have an appointment starting tomorrow between 11 a.m. and 2 p.m. We're excited to start offering these options for our community members who may not be able to sign up online for an appointment. And we hope that by doing this, we can remove barriers and that may limit residents who are ages 16 and older to receive that vaccine. And so as a reminder, it is now open to anyone ages 16 years of age to receive a COVID-19 vaccine. And individuals seeking a COVID-19 vaccine can schedule an appointment at vaccinate.tn.gov if they're able to, or they can come to our State Farm Operations Monday through Friday between 11 a.m. and 2 p.m. to receive that vaccination. If you do go on to our vaccinefinder.org, there is about 50 providers still within a 25-mile radius of the location that you all are in and where we are that are still vaccinating. I also want to take this time to thank Ascension St. Thomas, the Mobile Health Unit, Middle Tennessee State University, Murfreesboro Medical Clinic, Stonecrest, our school systems, and all of our pharmacies and Walmarts around in our county, as they have done an amazing job at being able to vaccinate several people, which I'm going to get you that number here in just a second, here in our county. So additionally, we are looking to continue our partnership with Ascension St. Thomas and the Mobile Health Unit to ensure that everyone can have access to the COVID-19 vaccine by removing those barriers that may exist for our poor and vulnerable populations that we serve. We hope to maximize our outreach efforts with the Mobile Health Unit and being able to host many vaccination events in our county. And so we will be able to get this information out through our public information officer where we're going to host those many events and where they will be located at. As we do understand there is also a little bit of hesitancy when it comes to COVID-19 vaccine. And so we've just started discussion on how we can educate and provide resources for our minority communities and those who may be have a little bit of hesitancy. So as always, I want to thank everyone for their patience and understanding as we're working quickly as possible to be able to provide resident vaccines to our residents. Also, I'd like to take this time to thank Cody York, the county IT team, and all of the call center workers that have provided assistance to us over the last couple of months. They have been a tremendous asset, and we definitely could not have done this without them. As we're starting to see a little bit of light at the end of the tunnel, the Rutherford County Health Department will start to resume receiving those calls for COVID-19 assistance here in the local health department, and we're open Monday through Friday, 8 a.m. to 4:30 p.m. and our local call center will be going away as we're going to bring back those calls to our health department. So our percentage of county population that has at least one dose is 28.5%, which is up tremendously over the past month. And so we're excited to start to see more people that are wanting to be vaccinated. So right now we're a little bit over 150,000 individuals in our county that have received vaccination. So at this time, I'm going to turn the floor over to Dr. McDonald, who's going to provide some additional updates regarding vaccines.
So we're still doing, of course, Pfizer Vaccine is the primary vaccine that we're doing. And people have questions about the Johnson & Johnson vaccine, which you know has had a little...
Dr. McDonald, I'm sorry, we're having a hard time hearing you. You might need to move a little closer to the microphone.
I can.
Thank you.
Is that better?
Yes, much better. Thank you.
Okay. So as Shannon said, we're still doing the Pfizer vaccine, and the Johnson & Johnson vaccine, a lot of people have questions about that, and that's been released again. And as you know, the issues that were found with that vaccine was in like 15, I think eventually 15 was kind of the number they settled on. People had cerebral venous sinus clots, which are up in your brain, so that's kind of scary. And that age group was between the ages, I think, of 18 to about 44, so kind of premenopausal women. They're working on it. It seems to be a platelet issue, and the platelets kind of get turned on in a strange way. But overall, the vaccine has actually been very safe, so it's back on the market, and people, I guess some people will be shy of coming to get it, but we'll see how that goes. Otherwise, the vaccinations have gone really well. We've gotten pretty good at it. We've really evolved from the pencil paper era to the electronic era to get people through fairly quickly, to get the information put in the database by the end of the day. And for the most part, for the whole time that I've been in the vaccine clinic, we've just really never seen any issues with anybody having any big time side effects or anything else. So all in all, I think it's been very well accepted, and it's what we need to do to get eventually get to the number that we need for kind of what they call the herd immunity, so that people who can't take the vaccine for a variety of reasons will be protected. Other than that, I think we're just carry on doing what we do, and we're getting more efficient and doing it better. Every day we're quicker. Is there anybody with any specific questions that I can answer?
I actually have one for you, Dr. McDonald. I know most health experts have said that the best vaccine that you can get is the one that's in front of you. And so my question to you is, how will you handle at the vaccine sites, how will you handle it if someone has a specific vaccine they want or one that they don't want?
Well, that's happened. People come in and they say they want Moderna, and the bottom line is we just don't have Moderna. We can direct them to the places that do have Moderna. Some people only want Pfizer, and when we had both, didn't want Moderna, and we would just work with them. We can only do what we've got, and right now all we've got is Pfizer, which is a great vaccine. It's very effective. It's 94.5% effective after 2 doses, and for countries that have only done one Pfizer, 6 months out, it's over 80% effective, which is pretty good.
Excellent.
So that's mostly how we handle it, and then we can direct them if, we'll give them the names of the places that do Moderna if that's what they want.
I guess I was more concerned about those that would get there and possibly reject the opportunity to have a Johnson & Johnson. I didn't know if you were giving that vaccine or not. That was really my bigger concern.
Not yet. No, we don't do Johnson & Johnson.
Okay.
We're solely Pfizer. And people, for the most part, don't actually know, will come up, and even though the information is all about Pfizer that we give them, it's interesting. They'll say, so what am I getting today? And we say, well, we only do Pfizer. And for the most part, that's perfectly fine with everyone.
Excellent.
It's a great vaccine.
Well, I think that's good information just for the public to have, that's the one that we're issuing. So.
Madam Chairman, this is Jeff Phillips.
Yes, sir. Go ahead.
Dr. McDonald, you mentioned, maybe LaShawn mentioned about the partnership with St. Thomas. I know it's free if we go through the health department, but what if citizens go through St. Thomas? Is there a cost associated to that?
No, so there's not a cost associated with the vaccines at any of the locations that have received vaccines from the federal government. And so there's going to be pretty much all locations here in town. And so they might ask you for additional information based off of what they're needing for their system to input things into. They may ask you for your identification. They may ask you for your insurance card, but your insurance is not being charged, nor should they be charging a fee for those vaccinations.
So the insurance companies are not being charged?
No, sir.
Very good. Thank you.
Thank you. Good question. Are there any other questions for the health department? Commissioner Blair?
They have a new assistant director now. I think his name is it John Blair?
Yes, John Blair is our new assistant director for the health department.
I just want to make sure everybody understood that he is not a direct relative. You would have to go all the way back to Inverness, Scotland, probably, to connect us. So with this day of political accusations, I just want to make sure everybody knew that he was not a relative, an immediate family member.
Very good. Very good. Any other questions for the health department? If not, I'll entertain a motion for the report.
Approve the report, Madam Chairman.
Thank you. We've got Commissioner Phillips on the approval, Commissioner Gurley with the second.
Commissioner Blair,
Yes.
Commissioner Key,
Yes.
Mr. Gammon,
Yes.
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Chairman Allen.
Yes, thank you. Before I dismiss you all, I'm going to ask you the same thing I ask you every month, which is there anything you need from us? Is there anything that we could do to help you do your jobs better?
And I think I'm going to give the same answer every month as well. Just your continued support. We truly appreciate the support of each one of you all in getting the messaging out about COVID-19 vaccinations and or testing. In addition to just continuing to preach, our W's, wearing a mask, watching your distancing, and washing your hands. As we see the light at the end of the tunnel, I think that if we can do our part and wear a mask, even if we're not being told to do so, or even if it's not something that's in place for us to do, just continue to strengthen our public health efforts so that we can get back to our traditional lives of whatever that may be looking like as we move forward with this. But we truly appreciate your support in everything that we've been able to do and accomplish here at the Health Department, and we definitely could not do this without your support and the support of so many others in our community.
Excellent. Thank you so much. We appreciate you all. Okay, next on the agenda is the Community Care Report. Mayor, do you have anything you want to share on that?
Thank you, Madam Chairman. We're still we finally found a substance that will adhere to the concrete block. That was one of the issues that from the very beginning they just didn't want to paint the concrete block in the wing that we're remodeling. It just looks institutional and old, and even with fresh coat of paint, so they've found an epoxy type substance. It's an adhering quickcrete product that they'll spray. It's kind of like stucco that'll adhere to the concrete block, and then I think they can go ahead and put the dye in it and it will adhere to the concrete. So they'll start that process in about 3 weeks. Other than that, we're cranking along, zero COVID, 3 weeks straight. Happy about that. Mary Beth, our director of nursing, her mother passed away, so she's out until this, I think she may have come back yesterday. So we had her in our prayers. But this coming Saturday, if you want to come out, I made the announcement last night. Mr. Bodery, who will be talking to us next, is on that board with myself. He's the chair of finance for CCRC. He and Melissa Harrell both donated $300 to buy seed to plant at the new garden that we've already tilled up. It's 2 football fields in length. It's going to be a huge garden, probably one of the larger gardens in Rutherford County. So this Saturday morning, 9 o'clock, the Riverdale FFA and the ag teacher is going to be out there. They're going to be planting the seeds in the right places, sections of that long garden. The inmates from our Correctional Work Center will tend to it. We do have water available from the well to sprinkle it. And they're planting enough product to take all the way into the fall, like pumpkins and squash and things. So all the food will actually come in back into the nursing facility and if it's an abundant crop, I'm sure they'll be sharing it with the Correctional Work Center, et cetera. So hopefully, and they're also, these FFA students are going to go into the butterfly garden, into the courtyard, and redo all that and put in some new plants and kind of freshen it up where the folks out there can come out there and sit, whether they're ambulatory or not, they'll be able to come out and sit and enjoy the flowers and the butterflies and et cetera.
And then we're still in the process of looking for a new administrator. Is that correct?
We are United Church Homes. They have 3 candidates they've looked at and will continue that search, and we'll let the board know at the next board meeting where we are. The architect is still working on the 24/7 daycare facility and they should finish up those plans within the next 60 days.
Any questions for the mayor on that? Commissioner Gammon?
With that garden, we might want to put no hunting signs out there, because we probably have some folks out here consider that a baited field, because I'm sure some deer and rabbits and things like that be showing up.
Well, I'm sure the deer will be coming to eat whatever they're planting at some point in time. So, yeah, that's a good point, Commissioner.
All right, I'll entertain a motion to approve the report.
So moved.
Blair, in a second.
Second.
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Blair,
Yes.
Commissioner Key,
Yes.
Commissioner Gammon,
Yes.
Chairman Allen.
Yes, thank you. All right, next we've got the special projects report. Ms. Jolly is not with us tonight. I told her there was no worries. There have been no changes to this report. It's the same report as what you saw last month, so there are no additions or deletions from that. So, but we do need the formality of approving the report.
Move to approve, Madam Chairman. This is Jeff Phillips.
Thank you.
Second.
Commissioner Blair, thank you.
Commissioner Key,
Yes.
Commissioner Gammon,
Yes.
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Blair,
Yes.
Chairman Allen.
Yes, thank you. All right, next we've got the school board reports. I believe they're Zooming with us.
Yes, Madam Chairman, if you don't mind, I'd like for us to take the two amendments. One of them is a cleanup amendment in 177, and one of them is an emergency request to purchase a HVAC for Holloway High School. If we could start with those, I'd appreciate it.
Okay, very good. Let me pause you just a second, Mr. Sproat. Can everyone hear him okay? He's a little bit of an echo chamber, but okay. Very good. Proceed. Thank you.
Okay. Is capital projects fiscal year 2021 cleanup amendment. This cleanup amendment moves the remaining funds from fiscal year 2020-2021 to current year approved projects that are completed or nearing completion, with the remainder of the project encumbered, to the new capital projects and or existing approved capital projects that needed additional funding to complete. This amendment requests no new additional funds from the outside the capital projects fund or utilization of any fund balance. Motion to approve Fund 177, capital projects fiscal year 2020-2021 cleanup amendment as presented.
Very good. Are there any questions on that motion?
I'm sorry, I can't see it. What's the total?
The total. Is that what that is? The total on it?
Yes, and that, the amount,
The amount that we're moving over, amending is, the remaining amount is $1,321,929.32.
Thank you, Superintendent. I move to approve, Madam Chairman.
I'll second.
Commissioner Gurley with a second. Further discussion, we'll take the roll call.
Commissioner Blair,
Yes.
Yes.
Commissioner Gammon,
Yes.
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Chairman Allen.
Yes, thank you. Okay.
All right, the next one is an emergency request for unit purchase for Holloway High School gym. Holloway High School gym is operating at 25% HVAC capacity at this time. They have a 10-ton unit without a compressor, which is ordered for a 20-ton unit is no longer available or operable. Maintenance is a quote on a 20-ton replacement unit for $59,551.57. We are requesting to authorize maintenance to replace a 20-ton unit not to exceed $60,000 with either one 20-ton unit or two 10-ton units. Motion to approve to authorize maintenance of the county maintenance or county school maintenance to replace the Holloway Gym unit not to exceed $60,000 as presented.
Good. Any questions about that?
Funds are available internally?
Yes.
Very good.
Move to approve.
Second.
Thank you.
Well, one other question, Madam Chairman.
Yes.
Holloway High, what do they use that gym for?
Physical education, and they do have, I do have basketball, some basketball.
Thank you.
Commissioner Gammon,
Yes.
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Blair,
Yes.
Commissioner Key,
Yes.
Chairman Allen.
Yes, thank you.
Madam Chairman,
Yes.
as we start reviewing this, for the simplicity's sake, could we go through just the highlights and then allow us then, we'll be coming back. We're not voting on anything tonight, as I understand it.
Right.
And then that'll give us time to make notes on the highlights, study this for the next couple of weeks, and then in the meantime, call Mr. Bodery and ask questions and be ready to discuss it in full.
Yes, sir. That's exactly the plan for tonight. And actually, in one of the attachments that Mr. Bodery sent to us, there is a highlight page. So, yeah, so he's gonna bullet point some of those items for us tonight. But yes, I absolutely, they provide us the courtesy of giving this to the Health and Ed a month in advance to give us a chance to scrutinize it, so we're not just sitting down for the first time in May looking at it. I went ahead and sent this also to everyone on the Budget Committee so that everyone has time to look at it between now and the time we have our joint meeting in May. So. And before we move on, though, Doug, did you have those first three on the agenda items that were for information only? Do you need that as a formality? Do you need to send that, go over that information? It was funds 143, 177, and 141.
Yes, well, if you're okay with it, ma'am, what I'll do is I'm going to stop the video here and I'm going to share my screen and let Mr. Spurlock go through the highlights. Then we'll walk through the smaller funds first. 143, which is the Centralized Cafeteria Fund. Then we'll go to 177, which is the Education Capital Project Fund. And then after we get done with those two funds, we will then go to the General Purpose School, the 141 Fund. And as Mr. Spurlock goes through each of the funds, I'll put the budget for each of those funds up so we can all follow along. And if that's okay, that's how we could do this, just to hit, as Mr. Gurley said, to hit the high points, as well as answer any questions that any commissioner has on the budget right now.
Great. So which fund are we going to start with?
I think the best way for us to do is hit the highlights, look at those increases and that impacts the individual, these individual budgets, and then allow the commissioners time to look at the detailed list and compare it to what the increases are.
Excellent. Thank you.
Okay. Let me share my screen.
Mr. Bodery, you're welcome to proceed whenever you're ready.
Can you see this screen on fund for the School Nutrition Fund 143? Is my screen being shared right now?
Yes, sir.
Okay. Mr. Spurlock, would you like to?
Yeah, as you can see on the highlights, one of the things that we're very, thankful for is we were able to centralize our cafeteria fund. And one of the things this did is provide us more autonomy for us to make decisions to move staff around. There are currently 48 schools that serve students, with 4 of those being a satellite feeding site and another with a school with a full kitchen. In the upcoming school year, 2021 to 2022, there will be 49. Of course, we'll be adding Plainview Elementary. With a centralized school cafeteria personnel management, the current fiscal year 2021 aligns more closely to what we're seeing in other school districts around Middle Tennessee. This allowed greater flexibility to better staff our cafeterias during the time of COVID. And it also allowed us an opportunity to recognize school nutrition labor benchmarks. And by that I mean how many meals per hour are being served in our cafeteria. When the centralized personnel management approach began, we had 467 total cafeteria positions. Once we implemented this, we were able to reduce this down to 384 full-time or part-time positions. Now, going forward, we want to continue to utilize these nationally recognized staffing benchmarks for adding direct labor to our operations, thus holding down costs. Now, continuing this staffing process will help us keep this fund financially sound, and it will generate surplus funding to increase the food quality and maintain the quality of staff while minimizing meal price increases. The proposed budget does have a 5% increase for all of our full-time and part-time hardworking employees. Additionally, we will be bringing a new salary schedule for our cafeteria managers in the near future to the school board to move our managers from an hourly to a salary pay. This will align us once again with other Middle Tennessee school cafeteria systems with our cafeteria managers' pay structure, and it will recognize the need for this position to be a professional and exemplary position. Our cafeterias were some of the first Rutherford County School hourly employees to utilize the electronic timekeeping system this current fiscal year. All of our hourly cafeteria employees are now utilizing the electronic timekeeping system instead of the paper sheets with significant savings in copy paper and man hours for just simply processing. Going forward into next year, this electronic timekeeping system will give real labor usage information by school for our cafeteria management. Of course, this summer we will be having the seamless summer option, which has been extended through 21-22. And I can't say enough good things about our cafeteria people. They have switched to being EAs. They've switched to being part-time custodians, and they've taken and did a fabulous job by covering not only our cafeterias, but assisting us in other areas of our operation. The second page actually shows you a breakdown in terms of the 2020, 2021, and a draft budget for the 2021, 2022, and you can see either an increase or a decrease there. And we'll all remember that $1.5 million we transferred in earlier this year, and we're getting back to where we're taking care of that. The revenue for 2021, $21,378,038. Projected revenue for the draft of 2021, 2022 is $21,122,000 with a deficit of $256,038. Everything else on there looks pretty good. The operating expenditures, one of the things as we look down below there in 73-100-710 equipment, we have put that off for a couple of years and until we can get more solid on this, and look at how we can go back out and be able to recoup some of the equipment that we need to replace. Then we may be looking at some ESSER money there. Net income there, as you can see in our draft, $874,074.05, an increase of $894,846.05.
And I'd like to add that we have typically budgeted a original budget showing a deficit, and once again being very conservative on the revenue and looking at full staffing on the expenditure side. But as Mr. Spurlock stated, I believe our labor costs are going to be significantly less because of how we're staffing now, which is the same as most Middle Tennessee school systems are doing already, which is meals per labor hour served, that national benchmark that says, you staff where you need your labor based on your production. And that's something that Mr. Spurlock wanted to see new this year, and that's what we've done, and we've seen some very positive results in actual operations, including the financial side. For that, we also, because of that, we've been able to, with centralizing the staffing component for our cafeteria systems, like the other county school systems, we've been able to shift from school to school cafeteria personnel. So in schools that had some issues with staffing in previous years, they don't have that issue now, because we can shift between the schools. Does anyone have any questions on this fund?
Any questions on Fund 143 before we move on?
Madam Chairman, I've got a couple, and these are just informational. Doug, can you kind of give me some type of a highlight or a synopsis of how COVID last year, the end of last year, and then the first of this year affected these cafeteria funds? And what did we do? Did we continue to cook meals even though all the kids weren't there? How did all that work? I'm still a little confused about that.
Yeah, we first started off, I think it was somewhere around over 15,000 kids on distance learning, probably closer to 16,000. We did provide, a seamless summer meal program that continued throughout the fall. So we did provide some meals for people to pick up. Obviously, it wasn't like we would normally get. And a lot of times during this time, we also would have cafeteria staffs would actually go out. We would have, several times we had a school where we didn't have cafeteria workers. And we were able to move some cafeteria workers around because of the number of students that they were serving in their current school, and we were able to bridge that. Now, it kind of started picking up after Christmas when we really started seeing an increase of meals being served. We got back perhaps maybe another 5,000 kids back into our building, which put that back up to where, where it was manageable. And we're still currently have somewhere around 12,000 still distance learning. So it's still not where it needs to be. But it was a trial and error thing. And in the middle of this, we actually switched to centralizing the cafeteria, at the first 3 months of school. So, in that 3 months, prior to that, it was not where it needed to be. So some of these things that we were able to move staff around, able to take some staff and move them into a different role, which saved on, they weren't just, they had the job, but it wasn't working in the cafeteria.
Thank you. I appreciate that information. And this is kind of off the wall. I'm not advocating this. This is just for me to kind of ask the question, because we just went through a new contract with our bus drivers in transportation, and it appears that none of our transportation, we own buses and don't have bus drivers anymore. It's all contract. Is there any school systems around the country that has cafeterias that are on contract and they're not run by the school system itself and school system employees? Is that something that is happening around the nation or not?
Commissioner Phillips, it's probably not as prevalent in Tennessee. However, it is occurring. Anytime you take an organization, whether it be private industry or whether it be, a public industry, you've got to look at the mission of what is your primary mission? Ours is to educate kids. The transportation, the food service are obviously got a part of that, but it's not the main purpose. So the whole point I'm trying to make here is a lot of times as you grow, you will find that outsourcing some parts of your organization is more beneficial as far as the return on investment. And I'm not trying to be crass with this and trying to say no one's worthy of their job. But what I'm saying is, with money scarce and money tight, and when you get away, you stray away from your primary focus, your mission, if you will, and you're investing this money in it, then obviously, you're not going to get what you're looking for. You're not reinvesting back in the primary purpose.
So is that something, if the trend continues on a national basis, and it may bleed into Tennessee at some point in time, is that something that the school board will look into at some point in time to see if it's feasible for Rutherford County to do something like that?
I think it would be incumbent for us to actually look at all aspects of that, yes.
Very good. That's kind of what I was getting at. I'm not advocating that we do it. I'm just asking that question. If there's other folks doing it at some point in time, and I'm not saying it's this year, next year, or 5 years from now, but at some point in time, we may want to look at the possibility of providing that service through an outside vendor, and if it's possible to do that and maybe even save money, or not even save money, but to provide a service that's acceptable. I just think we ought to have an open mind about that as we go forward in the future. Once again, I'm not advocating, and I just wondered if it's something that you kind of had your fingers on the pulse of what's happening in state and nationwide there. Thank you.
Very good. Any other questions on 143? All right, proceed to the next fund.
All right, the next one is 177, the Capital Education Capital Project Fund. Of course, the main revenue we know from 177 is from the county property tax, 7.5 cents. The first budget estimate for fiscal year 21-22 on what a penny on the county property tax levy will bring is $994,300. And of course, the shared, which we do in the 141, is a little bit less at $844,359, and that's a preliminary estimate. This year's requested capital projects is an estimated total cost of $7,565,917, and these projects are detailed on the preview. If you'll look there, it's on the second page, or he may have that up there now. We've got the proposed capital projects. We'll start with the revenue first. The operating revenue, or you want to go to the projects?
We can.
Okay.
As I can see, the revenue that we have in this fund proposed is the exact same tax levy as is in the current fiscal year, the 7.5 cents. Working with Lisa Nolan with the County Finance Department, for the most current estimate for property taxes, the unshared penny brings us this. As Mr. Spurlock said, obviously with pickups and as we move through the budget cycle, just like last time and the times before, Ms. Nolan will bring an update for what that penny will bring. That property tax, along with a small amount of budgeted business tax, brings us to the $7,733,917. And that's the revenue side. Once again, we have that on the revenue side, same tax levy as this year. On the expenditure side, we have the trustees commission for processing the property tax in this fund. And dropping down, we have the actual $7,565,917 of proposed capital projects. And let me move to the detail.
Doug, before you change screens, can I ask you, on that line 40162, pay in lieu of taxes, local utilities, is that where the Murfreesboro Electric Department money would have been?
No, ma'am. It's this right here. I have that. I apologize. I should not. I've left that line open. All of our payment in lieu of taxes for the local utilities is in the general purpose school fund, and I won't be talking about revenues today on the 141 side because we're still waiting, and for our BEP estimate, the state is almost a month late with the April estimate. But we hope to have that this week or next, and then we can, provide revenue estimates. But to answer your question, ma'am, that would have been in the general purpose school fund. We still have a, in lieu of payment from Nashville Electric, and I'll have that budgeted on the revenue side in the GPS fund.
Good, thank you. Any questions on Fund 177?
Mayor,
you guys
could you
like
make
to
the
look
phone
at
call
the-
and get them to,
I'm sorry. Gentlemen, wait 1 second. Commissioner Blair had a comment.
I was just going to get the mayor to call the state and ask them to rush up that budget information since they're a month late getting it to us.
Well, we're actually waiting for that bill to pass, hold harmless BEP. We feel pretty confident it's going to, but we'll have to know soon.
Very good.
As you can see right here, and this was one of the handouts that I sent for your review. This is the detail of that total on the budget. It's a breakout for each of the proposed capital projects for next fiscal year. That makes up that bottom line.
Doug, what is a BAS graphic interface?
Would you?
It's on the
It's right below the ADA required renovations at $60,000, BAS graphic interface.
I would have to ask Mr. Lee. I apologize that I don't have the answer to that one right there. But I can find out, and I will email the explanation to you and the rest of the committee, ma'am.
Yeah, everything else is pretty self-explanatory. Gym floors, servers, all of that. Pretty typical terminology. I just wasn't familiar with that one. Commissioner Blair?
I'm a little surprised to see only one major roofing endeavor. I guess the programs that have been put in place in the past have finally got us in pretty good shape with most of our roofs.
Actually, Mr. Blair, we are working on the application for ESSER 3.0 is open. It closes in late May, and we'll be using some of that ESSER money to get some of that roofing taking place. What we're showing you now is from the 2021, 2022, based on the 7.5% tax levy. But we will be bringing a sizable amount to address HVAC, plumbing, and roofing.
I should have stayed quiet.
All right, you can continue, gentlemen. Thank you.
And there you can see right there at the very bottom line is the bottom line, the 7.565, tying to the budget that we just presented.
Okay, hold just 1 second. Commissioner Gammon, did you have something?
Just had a quick question about the lifts for high schools. For instance, it's got 6 times 12,000, then it's got 24,000 over in the green. Is that hydraulic lifts? I'm just for my curiosity, what's the lifts for the schools?
What page is this on, sir?
It's miscellaneous items under Siegel middle fence.
I see what you're saying, sir, and how many there is, 6 times 12. This might be and I will double check with Mr. Lee, this might have been the original ones that he wanted, like 6 of them, and cut down, he can do 2, but I will double check. But I would say that was what he originally needed, and then with his request to meet that budget of that 7.5 cents, he just tackled 2 this year. But I will double check, but I would say that's what that is.
Okay, thank you.
I'm still a little confused about what a lift is.
It's primarily what they use to change lights, what they do to, a variety of different things around in the school and in the high school. Sometimes you have to use a lift when you're working on the goals, and things of that nature.
That's what we used to call cherry pickers.
That's right.
Okay, thanks.
Very good. All right, Doug, you can continue. Mr. Spurlock, go ahead.
Go to the 141.
All right, next one is our highlights for 141. The general purpose school fund currently has a property tax levy of $1.0474. The first budget estimate for fiscal year 2021-2022 on what a penny on the county property levy will bring was $994,300. A shared penny, which is what we do in the GPS fund, is estimated at $844,359 on a preliminary estimate, with the remaining $149,941 allocated to Murfreesboro City School based on the weighted full-time equivalency ADA as required by the state statute in counties with multiple public schools. This proposed budget funds 85 of the 5,177 in the GPS fund operations. I'm assuming this is positions.
Yes.
Okay, the detail of these additional positions is on the budget improvement summary page that we'll go over here in a few minutes. The proposed budget takes into account the opening of Plainview Elementary in the fall of 2021, as well as an anticipated enrollment of 48,000 in the school year of 2021-2022. Right now we currently have on roll about 47,650. We could very easily go over 48,000. We just really don't know right now. Once we start getting past all the registration that we've been doing and get the testing out of the way, we can start crunching some numbers and looking at things. The proposed budget funds a 5% salary increase for all certified and classified employees. The cost of a 3% and a 4% and a 5% salary increase is presented on the budget improvement summary page as requested by the school board for review. The preliminary estimate expenditures for the proposed GPS fund budget is $444,797,500, which is an increase of $23,057,931 from the original 2021 expenditure budget, and is a 3.5% increase in expenditures from the currently amended fiscal year 2020-2021 expenditure budget. We're still waiting the first preliminary April ABEP revenue estimates for the state Department of Ed. Additionally, the State House, as what we talked about before, State Senate has recommended in Senate Bill 0774 to hold BEP harmless, and a companion bill of House Bill 0777 is on the regular calendar for vote on April 28th of 2021. That's this week, so we feel pretty confident about that. When they look at it, obviously they'll look at the 2021 ADM and you compare that, going forward, and we'll get the higher of the two comparisons. All right, on your general purpose budget and budget improvement summary, if we can take a look at that now and kind of look at where are these going. First of all, you can see the certified degree and experience raises. What we call those is, we call them step raises for the experience, and we call, when someone gets another different degree, we base that, we factor that in. As you can see, that is a $2,508,282. That's an 18 point for the FICA and medical and retirement, 18.31%. 31% cost per unit, you can see there, and additional totals. So overall, you can see what the increases are in terms of just experience and what we call step, which is their step raise, and when they get their additional degrees. The classified is only for the step experience raising. That's the step ratings. Okay, and then you can see the total there. Then you can see the 3%, how it impacts our budget with everything, including the salary plus the benefits. A 4%, how that impacts our budget. And then a 5%, and how that impacts our budget. So that part right there is a pretty hefty one right there. On the certified, as far as the growth is concerned, and you'll be able to look at that when you look at the detailed budget. When you look at the very first page of the detailed budget, 71 116, we have in there 23 growth positions, and each one of those things right there will add up to your 23. We got 10 growth positions for regular ed, music, art, and gifted, and ESL. 3 growth positions for Blackman Elementary interventionists and Stewart Creek Elementary interventionists and Rock Springs Elementary interventionists. We've got growth instructional coaches for Wilson Elementary, Kittrell Elementary, Las Casas Elementary, and Smyrna Primary. Plainview Elementary regular ed, music, and art, we've factored in 2 growth positions, and the reason why we only have 2 is because we've moved a lot of teachers from the location the students were rezoned from. Plainview instructional coaches, they'll start off with 2. Plainview Elementary interventionists, 2. Assisted technology specialists, 1. Teachers in SPED, we have 5 growth positions that we'll be placing throughout the county. And
They might, I just interrupt you on this. Gentlemen and ladies, if on this, on what Mr. Spurlock is reading from on the budget improvement summary, as you can see, what I've got highlighted right here, just so you can reference on the actual budget itself as he reads it. As you can see, on the right under the certified personnel new, the very first line says growth teacher regular ed, music, art, gifted, and ESL. Right next to that, it's got the line item 71-100-116 and the count of 10. If you go down the next few rows, everything that has the 71-100-116 line item, that's the 1, 2, 3, 4, 5, 6. Yes, that's the first 6 lines. That adds to those lines, all the 71-100-116 lines, total to that 23 number right there for the additional positions. And I just wanted you guys to see that for your reference.
And so on the detail there, on the 7100, the function 7100-116, that 23 additional positions increase, that's shown up on your budget improvements on those lines. It stops at the CTE, teachers and CTE growth 5.
You might want to switch to the classified
on
the 71-100 to show them.
Yeah, and if we'll turn the page and look at the next classified personnel on there, and that's 71-100-163. If you'll locate that on your detail, you can see there educational assistants, 71-163-4. Growth educational assistants for Plainview, 71-100-163-4. SPED educational assistants, 3, which are assigned to Plainview Elementary, 15.
We don't want to go.
Yes.
I apologize. Let me roll down.
Want to go down?
Yes, sir.
All right.
This is back on the. This is the ones that you're talking about right here.
Yes. Excuse me. So we should stop there. Okay. 71-100. We're on the 15 there. Okay. On the 71-100-163, 15, and if you'll look on your detail, come across there. I'm showing 8. Who did the total come?
We moved to the second page.
Okay, the second page. Okay, that's right.
We're on SPED.
SPED, sorry about that.
Sir.
All right, that's okay. 163. Let's see, is it the third page? Yeah, third page. Okay. All right, on 71-200. 71-200, special ed. 163, there's 15 positions. And there's that 15 on your budget improvement. Okay. On 72-110,
Page 6.
Page 6, or page 6, and let's see, that is 162, that is half a position.
Yes.
I think we'd be better off, because if we go like this route here, we're going to probably mess you up. I think if we go over the budget improvements, if we go over the budget improvement summary and know that these functions and object codes are related to each one of these items in our detailed sheet, that will give you time to go back and look at those. Would anybody continue the way we are doing, or would you rather us go over the budget improvement and allow you to take time to go back and look at those?
Okay, Mr. Commissioner Gurley has something to add?
Yeah, I think this is good. My only question is, Madam Chairman, are all these documents on our SharePoint, or will they be?
Doug sent everything over, everything. Yes, everything's on SharePoint.
Okay. Yeah, I think this is kind of information that I want to see. I can take this along with the detail and go back and track each item and see what it is. This is something that for each of us it's going to take several hours of going through, and I really don't see it's necessary. I think I have to commend our director and assistant superintendent for accounting for preparing these documents. We're not determining tonight whether we agree with these documents or not, but the information is presented very well. So I think I've seen enough that I can take this, go back home, and over the next few days and week or two, go through this in detail. And as I said earlier, make a phone call or two when I have specific questions. But it's a good presentation.
Thank you. Feedback from other commissioners? Commissioner Key?
Madam Chairman, might I have an opportunity to ask just general questions just for knowledge?
Absolutely, please do.
Okay, Director Spurlock, I noticed that the textbook, the line item for textbook has decreased dramatically and software has increased. Could you just speak on that? And do
we have had put out the
one more question. And do we have the coverage, and who would provide the software instruction? And is that, where would I find that in here?
Okay, let me answer your first question about the textbooks. This is the second year the state has put off an adoption, which means that we're not having to purchase textbooks this year, so it has decreased. As far as the technology, you asked about the software and things of that nature. It's in our line item, and we'll actually be. It's in our budget, but the reason why it's not going to show up as much is because we will be investing in some, using some of our ESSER money to purchase additional software.
Okay, so continue that question. So the school system's just not utilizing textbooks as we used to.
We're on like a 4-year or 6-year adoption period, and the text that we were to adopt here this last year has been put off a while. So we continue to use the old text, the older text. All right. So when the state comes in and we anticipate this next year, they'll come back. It'll be adoption year. So we'll see this will come back around next year. When they come back and we have to adopt. But right now, I think it's been 2 years where the math part of it. They're really changing. It's the math one that they're really looking at doing some changes.
Thank you.
Mm-hmm. One other item is on that right there, sir, is Doug Bodery. The textbooks is a really good example of, like Ms. Brock said, it was between implementation years. Mm-hmm. And I did not want to leave a number that wasn't accurate. So we reduced it to, what we plan to, an accurate estimate of what we're going to spend next fiscal year for textbooks. I don't put numbers in there that aren't accurate estimates, and that's the reason for that variance.
And to follow up on his question about instruction, is the instruction is going to be provided by the teachers utilizing that software? So there's not a separate instructor fee?
Right, that is correct.
I know it's a lot of information to digest, so please feel free to ask any of those kinds of questions. Now is definitely the time to do that. Commissioner Blair?
Remind me, did the governor, is he presenting a 4% this year?
Mr. Blair, it's like they always come out and say a percentage, and he did say 4%, but we all know, and all the commissioners know that by the time it gets to us, it's not going to be a fully funded 4%. But we know that there's additional funding for our salaries. But we don't know. We will get that same information about the same time we get our projected ADM for April.
Thank you, Ms. Spurlock.
Mr. Spurlock, for those folks who don't understand, like this committee does, how a 4% from the state does not translate to a 4% to our entire teacher population, would you just briefly explain why 4% is not a true 4% raise from the state?
Yes, ma'am. I'll start off by just talking about positions. We currently have somewhere over 400 positions that are outside the VEP. And it happens in large school districts, like that, and it makes a huge difference, when you're dealing with raises, and of course, the different degrees that teachers have, experience, all that goes into play, what it looks like, and quite frankly, even a 4%, no one really gets a 4%. From the state. I think the max on the instructional component is 75, maybe, and that's for some system whose capacity to pay is very negligible. So it's not what it appears to be. No, ma'am, it doesn't.
I'm sorry.
Yeah, go ahead.
And is the calculation, again, from what I remember from the last time we got this from the state, was they calculated 4% on an entry-level teacher's salary?
That's correct.
So again, if you have anybody with additional experience, that doesn't translate to their 4%.
Yes, ma'am.
All right. Any other questions for?
Another question. Director Spurlock, again, for my knowledge, can you just address the substitute situation? Just looking at the numbers here, it looks like the non-certified are necessary now where they weren't before.
You're right. You're absolutely correct. We're having more of our non-certified that are taking our jobs than the certified. I think for some reason, a lot of certified actually get jobs. And with the need for teachers all around here, you could pretty much stay busy, with a job. So that has been a shift somewhat for us.
I have one other question. How do we utilize our school psychologists?
Oh, yeah. Our school psychologists are the ones that do the assessments for our, to identify learning disabilities and things of that nature for our students. They also are the ones that for our already identified special needs students, each year they need to be, each 3 years they have to be tested over again. So they're staying pretty busy with a lot of things, dealing with special ed.
Mr. Spurlock, have you seen, can you calculate yet what the impact of COVID has been on your teacher turnover rate?
It's not been we're still looking at somewhere around in 92% retention. But it has had some, it's made some changes. It has.
Very good. All right. Any other questions for the director or Mr. Buttery?
Just one, Madam Chairman.
Yes, sir.
I think there are 32 pages here. You may have a copy of that in front of you.
Yes.
I do not. All I have is what I have on my email attachment. Doug, is there any way you could make a hard copy of that and then stick it in my mailbox over the next week or so?
Of course, sir.
Actually,
Very
Doug
good.
and Commissioner Phillips, Rachel has offered to do that for all of us. So she did that for me. So
Okay.
yeah, she's happy to do that for you. Yeah.
Might be good since since the schools are a big part of our county's budget, just to do it for all the commissioners if we're doing it.
Yes, very good. All right. Any other questions for school board before we let them go? And Doug is very available to anyone to answer questions. The school board has been abundantly transparent through the budget process. They always have been. So any questions that you have, I know that they'll be happy to answer them. As much of our homework that we can do as a committee between now and next month, we need to do that because it is a long meeting next month. It'll be our joint meeting with school board, budget. I do always remind everybody at the beginning of the meeting, it is a health and education committee meeting. We're the only folks who vote during that meeting, but anyone can ask questions, can participate in discussion. But if there's anything you want to know, especially if there's a tough subject, I never like to offer a gotcha question to anybody on the spot because it makes us all look bad. So it's just better if you have any sort of tough questions, things you want to know, let's do that homework between now and that meeting so that we can come out of that meeting feeling confident about the recommendation that we make. Commissioner Gurley?
Yes, Madam Chairman. I just remind everybody, the meetings can get a little bit contentious at times. We all have differing opinions of where we ought to be going and what we can afford to pay, but I would just, once again, encourage my fellow committee members and the other committees that will be involved, including the school board, to, as you've suggested, do our homework between now and then. We've got roughly 3 to 4 weeks to do that and do our homework so that we can address smart questions, and whether we agree or don't agree, we can be polite and courteous and non, like I said, everyone has a differing opinion, but that's no reason to be contentious and make it a bad situation, because each of us are trying to do the best we can, and that includes our school board, our school administration, and it's a lot of hard work. And like I said, I commend them for putting these together. I would like to make sure that this either comes out in email to us, or because I think these highlights and breakdowns and so on are good for us to help digest this information. So going forward, and that's all I have.
Thank you. I appreciate those comments.
Madam Chairman, I think that meeting, at least on my calendar, is for the 25th of May.
Yes.
So that is 4 weeks away.
Yes, so May 25th, we will meet at 5:30. It will be at Central Office at Rutherford County Schools. So, and like I said, it'll be a joint meeting with the Board of Education, Budget, and Health and Ed on that night. So it's always a pretty important meeting. If there's any way for you to attend, I encourage you to do that. With that meeting, this part of our budget is roughly 75% of the entire county budget. So every commissioner pays attention to it, but in particular, as the recommending body, I would just encourage everyone to be present if you can. Okay. All right, any other questions? Any other business for this committee?
Madam Chairman, if I could, it's really, you mentioned Zoom meetings. I think are scheduling in, if I'm not mistaken, this week sometime.
Yes, sir.
Maybe
Yes.
maybe the end of this week. Mayor Ketron, I've enjoyed joining some of those meetings via Zoom, especially Public Works, as they are getting into our waste disposal problems. I don't know if it's possible. I know we can listen to it on the TV, but it's hard to participate as a commissioner, not a member of that particular committee. Is there anything that can be done to allow non-committee commissioners to still Zoom meetings?
Thank you, Madam Chairman. Speaker Pro Tem, we'll be happy to check on that to see if we can still do that. I don't know why we can't. I mean, the technology's there, so why not allow other folks that want to watch, either commissioners or anybody else, they can watch. But we are broadcasting, I believe, on RCTV.
Right.
But if you want to Zoom, we can probably get that set up as well. I'll talk to Lee and Cody tomorrow and see if that can be done.
We've had a number of issues that have come up over the last 6, 8 months, 9 months, that have allowed other commissioners that are not members of the committee that's meeting to participate in those. And I think that's been real useful. I completely concur with us getting back to physically attending the meetings, but there are times when other commissioners don't really have to attend the meeting, but want to participate via Zoom, that I think they may be able to have some input, especially as we're getting into some pretty serious issues. Public Works is the one that really jumps out at me.
I'll check that out tomorrow for you.
Thank you.
All right, last call. Any other business for this committee? Very good. We stand adjourned. Thank you.